Hello, good afternoon. It's Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend clinic, Open Clinic with Dr. Trudy. Today we're going to look at pregnancy and we're going to look at the 8 reasons why you should start exercising in pregnancy. So many pregnant women are wondering if they are exempted from physical activity, but today we're going to discuss 8 major reasons why you should actually engage in physical activity. So please quickly announce your name, announce your location. I'm planning to spend about 30 minutes. So the first part of my presentation, I'm going to give you the 8 reasons. Then afterwards, I'm going to respond to your questions. Then after this, we also have another clinic in Facebook. So keep me posted in Facebook immediately. We're going to transition to Facebook. But let's quickly look at the 8 different reasons why it's very important you engage in physical activity. Very important topic. Now, if you're currently in the clinic and you are pregnant, please will you mind telling me your gestational age? So gestational age means the age of a pregnancy. So it's normally calculated in weeks. And also tell me your trimester. So are you within the first 3 months in your pregnancy, or are you within the second 3 months in your pregnancy, or are you within the last 3 months in your pregnancy? Pregnancy is broadly divided into first trimester, second trimester, and third trimester. So please, your trimester will determine the type of exercise you should indulge in. But generally, across the board, all pregnant women should, by matter of urgency, engage in physical activity every single day. Very important. Cumulatively, 2.5 hours exercise in a week. So you can break them down into little chunks. 10 minutes here, 5 minutes here. Then cumulatively, in a week, you would have received 2.5 hours of physical activity. Now, let's talk about the gains. Number one, when you exercise, when you stay active in pregnancy, it keeps your body, your mind, and your spirit healthy. Pregnancy can change you in so many ways, and you need to stay healthy in your body because that's the conduit you're going to use to have your baby. You need to stay healthy in your mind, and you need to stay healthy in your spirit. Now, physical activity will give you a good feeling. Physical activity will give you extra energy you need in your pregnancy when it begins to become challenging. So that's number one reason why you should engage in physical activity. Specifically, when you are engaging in physical activity, you are making your heart very strong. You are making your lungs very strong. You are making your blood vessels very strong. You are making your kidneys very strong. When all these organs are strong, the possibility you will have a good outcome in your pregnancy is very high. Number two, remember that in pregnancy, you are supposed to add expected healthy body weight that would enable you to go into labor and have your baby. When you engage in regular physical activity, exercises, safe one, it will help you to gain the right kind of weight. Every pregnant woman is expected to gain a specific amount of body weight based on your BMI. If you don't have this, you might likely struggle. You might likely have complications in pregnancy. So, number two reason to engage in physical exercise, it will help you to gain the weight you need to carry on with your pregnancy for 42 weeks, which approximates to 9 months. Now, when you engage in physical exercise, it will help you to ease some discomfort of pregnancy. Majority of pregnant women will experience constipation. Some will experience back pain. Some will experience swollen ankle, swollen feet. These are all the complications that can happen in pregnancy. Guess what? when you are engaging in physical activity, the possibility you won't have constipation is almost 99.9%, because when you are engaging in physical activity, you are also putting your bowels into action mode, so your metabolism will increase, so you can easily empty your bowel and you will not have any need to be constipated. And when you're exercising, you are also sweating, so you're replacing the sweat you're losing with fluid. And the more fluid you drink, the more you're likely gonna have easy bowel movement. So it helps in this regards. When you exercise, you're gonna overcome constipation, you're gonna overcome back pain. Back pain is expected in virtually all pregnant women. Why? Because your back, it's the center of your body where the whole weight of the baby is going to be carried. So when you have a strong back, when you have a healthy, fit core, the pain will be reduced. Also swelling. So the more you exercise, the more you're dissipating all the fluid that accumulate in pregnancy. Number 4, stress management and management of sleep. If there are 2 things you need in pregnancy, it's sleep and lack of stress. You don't need any additional stress, because pregnancy for some women is already stressful. And the best way to get a lot of anti-stress relief is through physical exercise. So when you go for walk and you sweat and you release your endorphins, what's going to happen is going to help you to manage your stress. There are some stressors you're going to deal with every day. But when you're doing this exercising, staying fit, your cortisol level will be low, your adrenaline level will be low. And when you have a need to sleep in the night, you will sleep better. But when you are stressing, you are increasing a lot of things up. And stress is worry, strain, or pressure you feel when you are not in a good place. And pregnancy, to an extent, can put you to a lot of stress. So when you are exercising, you are dealing with stress. You can sleep better. Now, when you are also exercising and engaging yourself in physical activity, you can reduce the risk of developing pregnancy complications such as gestational diabetes, such as preeclampsia. Majority of pregnant women might be predisposed to these 2 major complications, which can actually have adverse effect in your pregnancy, including leading to death. But when you are exercising, the possibility you might not be predisposed to developing gestational diabetes is very high. Gestational diabetes is the type of diabetes you can develop in pregnancy. When you exercise, when you are fit, the possibility you will avoid developing gestational diabetes is high. Why? Because when you are exercising, the possibility that your BMI will be within the normal range is good. The possibility that your blood sugar will be normalized is good. So exercise will help to prevent gestational diabetes. Now, exercise can also help you to prevent preeclampsia, which is a hypertension complication that can happen after 20 weeks in some pregnant women. So preeclampsia is a condition of having very high blood pressure combined with generalized body swelling, then protein in your urine. When you have these 3 combinations, the possibility you're going to have preeclampsia is very high. And preeclampsia is a deadly complication that can happen in pregnancy beyond 20 weeks. Now, when you are also exercising, you are placing yourself in a better position to allow your baby to attain up to 37 weeks. Every pregnant woman will normally want them to get to 37 weeks. 37 weeks is called term. When a baby gets to term, the possibility the baby won't have any complication is almost 90%. So most pregnant women are encouraged to exercise so they can carry their pregnancy up to 37 weeks. Any baby that is delivered before 37 weeks is called preterm baby, and they have a couple of medical challenges. So when you exercise, you are helping yourself to reduce the various risk factors I mentioned. Also, when you involve in physical activity, you will reduce the possibility of having cesarean section. I know so many women want to have their babies through the vagina, right? But guess what? Cesarean section is a normal interventional delivery. Vaginal delivery is a normal natural delivery. Now, it's not every woman that will have vaginal delivery. But here's the deal. When you are fit, when your pregnancy is going okay, when you're training your pelvic muscles, when you're engaging in Kegel exercise, when you're eating healthy and your baby is fine, the possibility the pelvic muscles and all the muscles that will help you to go into labor will function properly is very high. So women that exercise during pregnancy might likely avoid cesarean section. Now, I'm not saying that cesarean section is a bad thing. I'm just telling you that the natural way of having your baby is through the vagina. And when you place yourself in the right place, you will avoid operative delivery. Now, if your pregnancy ends in cesarean section, relax. Have your baby. The most important thing in pregnancy is to have the baby alive, is to have the mother alive, is to have the father alive, and possibly your siblings. That's the most important thing. It doesn't matter how you have your baby. Okay? So when you engage in physical activities, you're going to train your body, especially the pelvic floor muscles, which are the muscles that will help you to have your baby to be fit. So the fitter a pregnant woman is, the better for her. Now, also, when you are exercising and indulging in physical activity, it will prepare your body for labor and delivery. Labor and delivery is a learned process. Let me tell you why. If this is your first pregnancy, the likelihood you're going to enter labor up to 24 hours is very high. Now, if this is your second pregnancy, the possibility your labor will end before 24 hours is very high. So what am I trying to say? If you have had the experience of having a baby in the past, your second delivery upwards will be shorter. Now, it's all about experience. It's all about what you learn. So when your body is ready in a mode of fitness, when you go into labor, your body will handle labor properly. When you go into childbirth, when we tell you to push, you can comfortably push better. So activities like prenatal yoga and a couple of other aerobics will help you to practice deep breathing, deep meditation, methods that will help you to manage your labor pain. This is very important. So when you're going for your exercise, you're not just talking about the body, you're dealing with the spirit, you're dealing with the soul, you're dealing with your mind. So everything about pregnancy must work perfectly to give you a good chance. Now, finally, when you engage in regular physical activity, exercise, it will give you a lot of energy. When you have a lot of energy, you can do better. So these are the 8 important points, 8 important reasons why you should, as of today, if you are pregnant, to start your physical activity. Very important. I'm going to open the clinic now, and please feel free to ask your questions. We actually have a full house. I can see Dr. Ndiche. Dr. Ndiche, thank you for coming. I can see Chinwe. I can see Onyi. Then I can see Ezinne, Obuefi, and Chi Evelyn. So I think COO might be engaged. But guys, please start asking your questions. I'm expecting at least 5 questions from each member of SGHS. So Dr. Ndiche, ask me questions. Feel free. Let's make this interactive. Chinwe Jane, Onyi, Ezinne, Obuefi, Chinyere, questions are welcome now. Remember, tomorrow, in less than 24 hours, we will host our biggest event in 2022. If you love twins, if you love triplets, if you love quadruplets, come tomorrow, let's fellowship. The possibility of you having triplets, the possibility of you having quadruplets, the possibility of you having one pregnancy and having twins, it's high, by virtue of a couple of factors we're going to discuss tomorrow. So if you're interested in this summit, make sure you follow admin and register. When you register, please follow due process. Very important. Send us email. We'll send you a Zoom link. Everybody participating in the summit tomorrow, make sure you have Zoom. If you don't have Zoom, you are not qualified. Okay? Guys, ask me questions, please. Feel free to ask your questions. We have about 15 minutes. After this clinic, I will also go to YouTube, Facebook, and we're going to have another 30 minutes clinic. But please, it's time for your questions. If today is the first day attending my clinic, thank you so much. I appreciate you. Before you go today, please click on like. Please click on comment. Please click on share. And importantly, subscribe. When you subscribe, set your notification so that anytime I come live, you will know that I'm live. You will join and participate in real time. I come live every Tuesdays and every Saturdays. Tuesdays, 6:30 p.m. Eastern Time, US, or 11:30 p.m. Nigerian time. Saturdays, I come a little bit early, 12 p.m. Eastern Time, US, 5 p.m. Nigerian time. Okay, COO is in the house. Okay, guys, ask your questions. Let me see. Does jumping and running shake the baby around in the womb? This is a very smart, technical, diplomatic question. Now, everything is all about intensity. Okay? By default, your baby is safely developing in the amniotic sac and under the cushioning effect of the amniotic fluid. Okay? Now, everything is in moderation. When you are jumping, which we don't encourage, anything that will put a strain on the pelvic area, on the abdominal area, we don't encourage that. So the type of exercise we encourage in pregnancy are moderate intensity exercise, safe exercises like walking, like swimming, like little stationary bike, like little cardio, doing your domestic chores, little dancing. We don't encourage jumping up and down in pregnancy. Now, I know you might see a couple of women that are pregnant. There are even actually some women, you see on social media, they are going to gym, they are doing all those stuff. They might be trained athletic women. Their body reacts to things differently. When you do the same thing they are doing, your body is not conditioned to those stress, and you can elicit a couple of complications, including miscarriage, including of your baby. So please be careful. We want it to be physically active, but it needs to be moderate intensity. Anytime you are doing anything and you're gasping for breath and you can't talk, that's high intensity. Please don't indulge in it. Now, don't engage in any contact sports. Any physical activity that will put any trauma in your belly can cause damage to your baby. Okay? So don't enter bike, don't enter keke, don't enter any means of transportation that can elicit physical contact with your belly. Very important. If you're entering the car, make sure you put your seatbelt safely. Very, very important. Okay? All right. Any warning sign a pregnant woman should stop exercising? Definitely. Just like I mentioned, anytime you are gasping for breath, you can't breathe, you can't talk, your heart is fast pacing, you are experiencing cramping in your calf area, you need to stop. Very, very important. Because at that point, your body is now overreacting. So you don't need to go extreme. Mild, moderate physical exercise is what you need. Anytime you notice this, that's the time to take a little breather, stop, drink some fluid, and sit momentarily. The only thing I don't want you to do, don't sit like a couch potato. A pregnant woman is not expected to wake up in the morning, sit on the bed, manage to come downstairs, sit on the couch, sit. Sitting is new smoking. You must move, but you must move with precision and wisdom. Beautiful questions coming from Kenneth. What's the cause of hotness or swelling feet in pregnancy? Now, hormonal changes. Hormonal changes can alter your baseline metabolic rate. Now, there's an important hormone that controls all the metabolism in the body. It's called the thyroid hormone. Now, when your thyroid hormone is overfunctioning, you will be in hyperthyroidic state. Now, this might be a factor that might lead to what you experience as hotness, or it might also be due to changes in the reproductive hormones in the body. So remember the reproductive hormones, remember your estrogen, remember your progesterone, FSH, LH, prolactin. These are the important reproductive hormones, thyroid hormones. So any changes in any of these hormones can be a reason why you might be feeling this hotness. Now, it might also be a sign of inflammation, or it might also be a sign of infection. Now, generally, most women should have swollen leg, ankle here and there. But when you have extensive swollen leg, extensive swollen ankle, generalized body swelling, and we check your blood pressure, and your blood pressure is very high, and we send you to the lab, and we discover you have protein in your urine, we have a problem. You might likely have preeclampsia, which is a hypertensive complication in pregnancy that can lead to a lot of adverse effects in your baby, including death, which we don't want. Okay, so you need to be investigated further. Now, the reason why we encourage you to go for your ANC, do you know why? When you're going for your ANC is tailored by your age, by the risk factors. That's why women that are above 35 are classified as what? Advanced in maternal age. Once you are pregnant and you're 35, 36 and up, we will give you frequent appointments because that pregnancy is at risk. So we need to monitor you properly. Now, if you're 35 and you have hypertension and you have diabetes and you have obesity, then you have additional extra risk factor. So we give you more frequent visits to make sure you are okay, to make sure your baby is okay, to identify where we might have a problem, because the earlier we identify a problem in pregnancy, the better. This is the reason why you need to be religious about your pregnancy. It's not just enough to be pregnant, you confirm with your urine, then you run away. That's not right. You have to go for your blood test, you have to go for the ultrasound, we have to start monitoring you. So keep all your ANC appointments. Very, very important. It's a thin line between life and death in a baby. Something you are supposed to do as a mother. When you don't do that, you might be putting your baby in danger. So be careful, okay? All right. Is it advisable and safe for a woman with sackcloth to engage in exercise? Moderate, mild exercise is still allowed. You can still go for work. Now, I don't expect you to go to the gym and be jumping up and down like a monkey. Don't do that. You have a sackcloth. Remember the reason why you're having this sackcloth. You have cervical incompetence. The integrity of your cervix is compromised. So we want to keep that baby at least up to 37 weeks. So any woman with cervical sackcloth, I'm sure they gave you instructions before you went home, right? Keep those instructions. Don't be a couch potato. Don't go and lie down in the bed and they're bringing you food to eat and you say, oh, because I have sackcloth, because I'm pregnant. No, you have to still move, but you move with precision. You move with wisdom. The watchword is wisdom and balance. Okay, be careful when you have sackcloth. Be careful. There are, of course, definitely they must have told you about things you should do and what you should not do when you have sackcloth. Number one on the list: no sex. You should know that by now, because anything that will disrupt that particular support when you're going for sackcloth, what are we doing? We are supporting the cervix because the cervix is not strong enough to carry your baby up to 37 weeks. Okay. All right. What exercise is best to deal with swollen feet in pregnancy? Guess what? Walking works. Walking can help to redistribute the fluid that accumulates in pregnancy. So I will just tell you walking. But all those swimming, stationary bike, little aerobics, dancing can help to redistribute the fluid. When you stay in one place and you're not moving, what will happen? Your body will begin to accumulate a lot of fluid. And if you notice that your leg is swollen in pregnancy, at the end of the day, when you're done and you're about to sleep, bring a little stool, a little chair, place your leg on heart level, allow it there for some time so you can have some redistribution of the fluid after the day. But please make it a point of duty to move, okay? I love this question. What's the best time to start attending ANC? Immediately you've confirmed you're pregnant, go and start your ANC. That's the only thing I normally tell people. Now, I know different locations will tell you to come back in 3 months, in 4 months. Most times, by the time you're keeping to those standards, by the time you develop complications, nobody will know. So I will tell you this. When you get your pregnancy test strip, urine pregnancy test strip is positive, you can throw a little mini party, okay? Call your husband, call your mother, call your siblings, and you guys can rejoice. Then you book an appointment. You go for your blood test. When you go for your blood test, you can increase the volume a little bit. Now, when you eventually go for your ultrasound, which is the clinical confirmation of your pregnancy, then you can throw a big party. Once your party is thrown and done, run, don't walk. Run to a good hospital, run to a good experienced ANC provider, register for the ANC there. Okay? All right, guys. It looks like we have just few questions from the crew. Dr. Ndiche, I've not seen any question from you. Are you still in the clinic? If you're there, please indicate and ask your own question. Okay, guys, I hope you're ready for tomorrow for the Multiple Pregnancy Summit. If you miss this event, you've missed a lot. You will have yourself to blame, especially if you can afford to attend. Make it a point of duty. Today is the deadline. After today, admin is no longer going to take any registration. So make it a point of duty to register today. I'm going to go to Facebook. I'm going to still give you a couple of tips which you need to understand. Now, number one tip, you have to have Zoom. We host all our master classes in Zoom. So when you're registering, you're sending us evidence of payment, make sure you have a Zoom app in your device. So you must have a Zoom app. If you don't have it, then you might not likely participate. Now, it's a customized masterclass, customized summit. So what do I mean by customized summit? You have your special, unique link, which you have to click tomorrow by 9 p.m. Nigerian time, 4 p.m. Eastern time US. You click on that special link, you and your partner, both of you will see us, we will see you. You will hear me, you will hear Dr. Ndiche, you will hear Dr. Odega. Then afterwards, we'll collapse the clinic and we begin to tackle all your questions. It's my prayer that every desiring multiple pregnant mother will become by this time in 2023. It has happened before. So I'm so excited about tomorrow. I don't know about you. So make sure you register for that event today before the deadline, okay? Can exercising in third trimester close to EDD help break your water? Definitely a yes. When you engage in strenuous exercise, it can disrupt the baseline. It can disrupt, it can have one of few effects in the fluid. Now remember, when we are anticipating a woman going into labor and labor is not forthcoming, what do you notice we normally tell them? To engage in some activity, walk the staircase, do this, do that. Why are we doing that? To see if we can elicit labor. So yes, if you engage in extreme exercise about your expected date of delivery in your third trimester, yes, your water can break. And remember that when your water breaks, the next thing that will come is your baby. Okay? All right. And once it's 37 weeks, if your water break, it's not going to be P-prom. So P-prom is premature rupture of water membrane. Okay? All right. Do women carrying multiple pregnancy go into labor before term? The answer is yes. Majority of women who carry more than one baby might, most likely, deliver before 37 weeks. Now, if everything goes okay in some can get up to 40 weeks. Some can get up to 39 weeks. Some can get up to 38 weeks. But guess what? Any mother carrying more than two babies that goes beyond 34 weeks is in a good place. Why? 34 weeks is when the lung matures, and the lung is an important organ for survivability when the baby is outside the mother's womb. So the answer is yes. Majority of multiple pregnant women will be, they will go into labor before term, and that's fine. Okay? All right. That's if we allow you to go into labor. If you are not planning for elective CS, then you might likely go into labor and deliver your baby before 37 weeks. Is it a must to take cholesterol medication when it's a little bit high, or is it better to control by diet? This is a decision your provider will make. I won't make that decision for you. So if your provider felt the need to give you statins, which are drugs you use in controlling cholesterol, then take it. Don't ever query or look for an override. Like I'm keeping it real. We have to follow standards. It will not make sense to see your doctor who knows your medical history, who tells you stuff to do. Then you come to me, you expect me to override your doctor. That's not good practice. I can tell you the right things to do. I can tell you that some women might be on antihypertensive, anti-diabetic, anti-cholesterol drugs, and they can do better. They can modify their lifestyle, and we can remove those drugs from them. So there are so many people that might have hypertension, they might have diabetes, they might have obesity, they might have all the medical problems in the world. But if they modify their life and their life is conforming to health, we can tell them to stop taking any drugs. So there are some women that when their body weight is within the normal range, when you plot your body weight with your BMI, once you are in a good place, will tell you to stop taking anti-hypertensive, diabetic drugs so you can control them with lifestyle. So simply by engaging in physical activity and eating properly, you can stay off drugs. So learn how to eat your food like your drugs so you will not eat your drugs like your food. Admin, capture that for me. Okay, guys, I have just 1 more minute. Then the clinic will end. This is very important for all pregnant women. Do we have any pregnant woman in this clinic? Tosin, you're just coming in. I'm sure you're very busy with the kids. If we have any pregnant woman in this clinic, please quickly indicate. My time is up. And please, after this, please quickly go to Facebook so we can talk to our community in Facebook, okay? All right. Do we have any other questions? If we don't have any other questions, thank you so much for coming. And please join me in Facebook. Please don't make our duty to be very laborious. The deadline for the registration is today. We don't want anybody rushing tomorrow. When you rush tomorrow, what's going to happen is if you pay money and you rush and you're not processed, you have paid and you chose not to participate. So the earlier you get ready ahead on time, the better. Must a woman bleed after IVF? No. IVF is not synonymous with bleeding. So anytime you have bleeding in pregnancy is a danger sign. You need to ring your doctor and you need to go in for assessment immediately. Okay? All right, guys. All right. Thank you for coming. I appreciate you guys. I'll see you tomorrow if you're attending the summit. Until I see you, my next clinic will be on Tuesday. God bless you for coming. And I'll see you guys in Facebook. Bye-bye for now.